Bismillah ar-Rahman ar-Rahim. This lecture is arranged for the first grade in Medical College, AL-IRAQIA University. We will start the second semester by explaining the lower limb, and the pelvis or the pelvic girdle is an important subject to be taken. We will concentrate on the bones, the anatomical bony landmarks, and some few points regarding the clinical anatomy. The pelvic girdle or the hip consists, or the pelvis is also called, consists of a right and a left hip bone. Each hip bone, each part, consists of three bones: the ilium, the pubis, and the ischium. The ilium superiorly, pubis anteriorly, ischium inferiorly and posteriorly. These three bones will articulate together with each other, and their fusion will continue until the age of 23 years old. يعني يلتحمن بعدين لحد العمر 23 يلا يلتحمن سوية. They are connected together and they reach they meet together at the acetabulum. The acetabulum is a cup-shaped part present in the hip bone on each side. It is for the articulation of the hip joint with the head of the femur. وهسه بصور جاية لي قدام نوضح شنو اللاند ماركس اللي بالاسيتابيولم المطلوبة من عندكم. بالعملي طبعا راح ننزل صور، راح أشر تأشيرات على اللاند ماركس اللي مطلوبة. يعني we study the bony pelvis by acknowledgement of by knowing the landmarks which are present. اكو landmarks راح نوقف عليها لأهميتها، واكو راح نذكرها مجرد تعتبر a site for attachment of muscles and ligaments. For example، طبعا أنا ما يعني معودة إنه ما أقرأ السلايد. هذا السلايد اللي قدامكم بكتابة ممكن تقروها، أعتقد تكون وافية لكم من خلال هذه المحاضرة والكتابة الموجودة. إن شاء الله تكون كافية إنه تتعرف على البلفيك جيردل، لكن طبيعتي إنه أنا أشرح وكلامي راح تلقاه من ضمن الموجود بالسلايد. I have in the ilium, for example, we have this is called the iliac fossa, and we have posteriorly, dorsally, we have the gluteal surface of the ilium. Also on the ilium, طبعا the iliac fossa serves for origin of the iliacus muscle, one of the major muscles that we will discuss within the muscles of the lower limb. And also the ilium represents the flank. Okay. It consists of an edge. The superior edge is called the iliac crests. This crest ends anteriorly as a spine called the anterior superior iliac spine. ومثل ما قلت anterior معناها أكو posterior، فإذا تتبع هيجي كله للأخير راح يصير posterior superior iliac spine. مثل ما قلنا superior معناها أكو inferior، ف this is the anterior inferior iliac spine. مثل ما قلنا posterior superior iliac spine أكو posterior inferior iliac spine. Importance of these spines: the anterior superior iliac spine and the posterior superior iliac spine represents the end anteriorly and posteriorly of the iliac crests. And also the anterior superior iliac spine is important because it serves the lateral attachment of the inguinal ligament. The inguinal ligament is a strong ligament, one of the strong ligaments in our body, that extends from the anterior superior iliac spine to the pubic tubercle. On the pubic bone, I have an anatomical landmark called the pubic tubercle. The inguinal ligament will attach between these two landmarks. طبعا the inguinal ligament is a strong ligament, represents the furrow between the trunk above and the lower limb below. While the anterior inferior iliac spine is a landmark for attachment of several muscles. The posterior superior iliac spine is important because anatomically they represent the dimples which are present at the end of the back. يعني when we expose a person, a human being, look at the back, at the end of the back we will find two dimples. رصعتين راح نلقاها. These dimples represents the middle of the sacroiliac joint and represents the posterior superior iliac spine. يعني this is important to be mentioned. احنا لازم مثل ما نعرف we study the body anatomically and there are some surface anatomical bone landmarks it should be also known. فالdimples when they ask you يعني من تباوع عليها وتريد تعرف هاي شنو اللي جواها represent what, we can say it represents the posterior superior iliac spine and also we can say it is the middle sacroiliac joint. هذني الاثنين مرتبطات بهذه النقطة. The posterior inferior iliac spine serves for attachment also of several muscles. فهسه صار عندنا on the iliac I have the iliac fossa, I have the gluteal surface of the ilium dorsally, iliac crests. The highest point in the iliac crest there is a tubercle, we call it the iliac tubercle. فصار عندك anterior superior iliac spine, posterior superior iliac spine, anterior inferior iliac spine, posterior inferior iliac spine, iliac tubercle. هذه كلها نلقاها on the ilium bone. When you come towards يعني نتيجي على الإلياك فوسا وتنزل هيك لي جوا you will find a line. This line is called the Iliopectinial Line. The Iliopectinial line is a line that will divide the iliac fossa above from the pelvic surface below اللي هو إذا ننزل بعد جوا راح نلقي الإسكيم موجود. Okay, so this is the Iliopectinial line. Iliopectinial line is very important because when it is united with the other side من نجي to the other side يصير عندي فد حلقة ويا الساكرم posteriorly ويا البيوبس anteriorly راح يصير عندي فد line, a circular line أو oval line راح نسميه the pelvic brim اللي in the next slides نوقف عليها clinically. It is very important to be known and it will distinguish between two parts of the pelvis. نيجي عليها بعد شوية نحكي. بس خلينا نكمل. هسه كملنا الإليوم. نيجي بالنسبة إلى البيوبك. The pubic bone is present anteriorly, consists of a body and two rami, superior rami and the inferior rami. On the upper part of the body we will find the pubic crests. نهايته راح يكون the pubic tubercle which serve the medial attachment of the inguinal ligament. طبعا the two pubic bones are united together by a joint which is the pubic symphysis. The inferior rami of the pubic will unite with the ischial rami. هسه إذا نيجي على الإسكيوم which is the lower bone of the hip consists of a body and a single ramus. A body and a single ramus. This ischial ramus will unite with the pubic inferior ramus of the pubic bone forming the ischiopubic rami. باوا على هذه الفورامين. This foramen is called the obturator foramen which is the largest foramen in the skeleton. Wrong if you say the largest foramen is foramen magnum. دائما من يسألون الطلاب يقولون what is the largest foramen in the body. مرات يغلط ويقول the foramen magnum اللي هي الفتحة الموجودة بالسكال يعتقد إنه هذه أكبر foramen موجودة. No, it is one of the largest. يعني it is of the large foramens in our body, but the largest foramen is the obturator foramen. It is covered by a membrane called the obturator membrane. So if we look at the obturator membrane, we will find that its inferior border represents the ischiopubic rami, while its superior border represents the superior ramus of the pubic bone. اوكي. حتى نروح على غير سلايد. قبل ما نروح أريد شوية نحكي عن الساكرم بما أنه واضح هنا بهذا السلايد. The sacrum, when you look at it, طبعا it consists of a fused 5 sacral vertebrae from S1 to S5. من S1 إلى S5 يلتحمن تكون لي this كأنما single bone called the sacrum. الساكرم because of this fusion you will see anteriorly هاي نسميها the anterior sacral foramina. مثل ما قلنا anterior معناها اكو posterior من تباوع عليها من الخلف يصير اسمها posterior sacral foramina. وهسه بالسلايد المقبل نوضح بقية اللاند ماركس اللي موجودة على الساكرم. بس الساكرم I want you to know that on the ilium there is an auricular surface which will unite with the sacrum on each side forming the sacroiliac joint. Sacroiliac joint on the right and left sacroiliac joint on the left. Important about the sacrum in which مرات نأشر عليه ونقول مثلا what are enumerate some structures that are related to it. يعني شنو الستراكشر اللي ممكن نلقاه inside the body نلقاه related to the sacrum قريبة من الساكرم. هنا ماذا نحكي عن organs that lies anterior to it. يعني اكو هواية همينة طلاب يغلطون ويكتب لي rectum و part of the intestine ويكتب لي فد muscle. No, هذني عادة يكونن related anteriorly. I said intimate relation to the sacrum. I have importance to a structure which lies on each side of the sacrum حتى it is related to the sacroiliac joint همينة اللي هو اسمه the sympathetic chain. The sympathetic chain has a relation to the sacrum وبعدين it will unite with the other side to form the ganglion impar. فهذا important relation. يعني sympathetic chain اللي هو طبعا part of the autonomic nervous system, and also I have a vessel which is called the iliolumbar artery has also an intimate contact to the sacrum. الرest اللي هو مثلا the rectum related anteriorly. عندنا أيضا I have also muscles, ligaments. هذه يعني represents anterior relations to the sacrum. Also when we study anatomy we should know that there is a gender difference between male and female. The sacrum also differs from male and female. In the next slide we will illustrate the facts that from it we can distinguish between the male and female pelvic girdle. To continue about the anatomical landmarks, I have this important شوفوا اللي دا أشر عليه هسه. This is from the ischium. الاسكيوم احنا قلنا consists of a body or consists of a ramus, and it has two very important anatomical landmark. One of them is called the ischial spine, which is present here. هذا هو the ischial spine. The ischial spine is a spine arising from the ischial bone. It is a very important anatomical bony landmark. Clinically, it has its importance in obstetrics and gynecology. بالنسائية والتوليد يهتمون بهذا landmark because the dimension between the two and the length between the two could be one of the indications that we can say about the pelvis, whether it is adequate or contracted. And this is important for the female to have an adequate pelvis for pregnancy and labor, while if she has a contracted pelvis, she can never deliver normally, and she should always be subjected to an elective cesarean section. لازم دائما تسوي قيصرية. وهذه هم بالسلايدات الجاية من راح نجي راح نوضحها. بس أريدك تعرف إنه between the two ischial spines the dimension should be 9 centimeter or more. 9 سنتيمترات or more ممكن تكون المسافة in order to say that this is an adequate pelvis. اوكي 9 سنتيمتر. راح تقول شلون راح اقدر اقيسها؟ راح اقول لك ناخذ اكس راي and احنا من ناخذ الاكس راي in several views. one of the views مثل هذا تقريبا نقدر نشوف the two ischial spine. فنجي نحط ايدينا بهالشكل هذا ف it should be يعني in two ischial spines away from a 5 finger breadth. تقريبا ال 5 fingers in human being تقريبا تكون 10 سنتيمترات. فإذا صارت ال two ischial spine away from this hand ف adequate pelvis يكون. Okay, فعندنا هسه the ischial spine is an important anatomical landmark. Also, I have the ischial tuberosity. Ischial tuberosity is a rough area present on the ischium. Also, it is important. Why? Because there will be attachment of an important ligament called the sacrotuberous ligament number 1. هذا الأهمية الأولى. والأهمية الثانية إنه we sit on the ischial tuberosities. يعني a lot of people mistakenly think that we sit on the sacrum or we sit on the coccyx. يعتقدون إنه إحنا نجلس على العظم العجزي أو العصعصي. This is wrong. أنت هسه طبيب ولازم تعرف إنه we sit on the two ischial tuberosities. Okay. طبعا the ischial spine also serves for attachment of another important ligament اللي هو the sacro-spinous ligament. The sacro-spinous ligament and the sacrotuberous ligament are two important ligaments because they will convert two regions. One of them is called the greater sciatic notch. يعني احنا هنا هذه نسميه the greater sciatic notch. بعدين يجي the ischial spine جوا راح يصير اسمه the lesser sciatic notch. So the presence of sacrospinous ligament بعد هو من اسمه sacro يعني جاي من الساكرا spinous يعني راح للإسكيال spine. Sacrotuberous ligament يعني جاي من الساكرم ورايح to the sacral tuberosity. These two ligaments will convert the greater sciatic notch and the beneath lesser sciatic notch to greater and lesser sciatic foramina. And these are important because through these foramina also there will be structures that will pass from the gluteal region to the lower limb. يعني من نمشي بالمادة راح نعرف شنو هذه ال structures that pass through. بس هسه أريدك تندل الإسكيال spine وتعرف فوقها يسموه greater sciatic notch وجواها يسموه lesser sciatic notch. ومن راح تشوف the ligaments اللي هي sacrospinous sacrotuberous راح يصير اسمهم greater sciatic foramen and lesser sciatic foramen. صار هسه عندنا الاناتوميكال لاندماركس iliac fossa, gluteal surface of the ilium, Iliopectinial line, Iliopectinial eminence, Iliac crest, Iliac tubercle, anterior superior iliac spine, anterior posterior anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine, ischial spine, ischial tuberosity, ischial ramus, body of the ramus, pubic body, pubic crest, pubic tubercle, and the superior and inferior rami of the pubis. هذني الاناتوميكال بوني لاندماركس عددتهن وراح تفتح الأطلس ولازم تندلها واحد واحد موجودة. هذا السلايد مؤشر على الانتيريور superior iliac spine. الكلام هذا الموجود هو كله هسه اللي قلته. من راح هنا بهذا السلايد مؤشر على الجريتر سياتيك نوتش. شوف هذا الجريتر سياتيك نوتش وبعدين يجي الاسكيال سباين وجواه راح يكون the lesser sciatic notch and this is the ischial tuberosity. Okay, this is a view about a hip bone as an individual. هنا فاصل لك the two hip bones. You can see this view and this view. This view, the acetabulum is very obviously seen, and it is a cup shape as we said. اللاندماركس اللي بداخله أريد المطلوب هو this horseshoe shape smooth surface called the leonate surface, acetabular leonate surface. هذه راح يجي ال cartilage of the head of the femur and articulate with it. And at the end of this horseshoe shape, I have the acetabular fossa, where there will be a transverse ligament called the acetabular ligament. Okay, فصار عندنا the leonate surface of acetabulum, acetabular fossa with the acetabular ligament. This is the greater sciatic notch, ischial spine, lesser sciatic notch, and the ischial tuberosity. طبعا on the iliac surface, on the gluteal surface, we have lines also. عندنا فد lines اللي هي serve for attachment of the gluteus maximus, medius and minimus. تمام. هاي نام 20 عن ischial tuberosity. The two hip bones, as you see, they articulate anteriorly at the pubic symphysis, as I said, and posteriorly they articulate with the sacrum through the sacroiliac joint. Okay. مثل ما تشوف, the inferior ramus of the pubic bone on each side, this angle is called the pubic angle. The pubic angle is also important for indication to differentiate between a pelvis of a male and a female. In the male, it will be lesser than 90 degrees, the pubic angle, while in female, it will be wider than 90 degrees. فهمين راح تقول شلون أعرفها من خلال X-ray if he is alive, or طبعا بالطب العدلي من خلال الرفات يقدرون يتعرفون من يشوفون الهيب بون pubic angle. If it is less than 90, they know it is one of the indications this pelvis could be for a male. If it is more than 90, it is for a female. Okay. What I mentioned was the anatomical landmarks, anatomical bony landmarks of the pelvic girdle. Now, I will talk about an important, this is regarding clinical anatomy. نقدر نخليه هذا من ضمن الكلينيكال anatomy اللي هو what is the true and the false pelvis. We previously, in the introduction of anatomy, we mentioned that the body cavity, one of the body cavities was the abdominopelvic cavity. And I mentioned that there is no partition between the two cavities. ما عندي في شيء يفرق لي بين الabdominal وبين pelvic cavity. بس lower من تيجي to the lower abdomen near to the pelvis. At the pelvic bone, I have this green line مثل ما مرسوم عندك بالفيو, which consists of the Iliopectinial line on each side, the union of the two Iliopectinial line with the promontory of the sacrum. إذا تسألني شنو promontory of the sacrum, أقول لك S1 من إجا يعني بداية الساكرم. It has on its body, it has a tubercle to the forward, and it is an angle يكون موجود, it is responsible for a promontory called the sacral promontory. So the sacral promontory posteriorly with the Iliopectinial line on each side, with the Iliopectinial line on each side, and the posterior surface of the pubic bone and the posterior surface of the pubic bone, this will form the pelvic brim. The pelvic brim, the cavity which lies above it is called the false pelvis, and the cavity which lies below it is called the true pelvis. Okay, نجي نوضحها. Why is this called the false pelvis? This is called the false because it is lined by bone only posteriorly by the sacrum and the vertebral column, and laterally by the iliac crest or the iliac fossa, iliac fossa والiliac crest. while anteriorly I will have the lower part of the anterior abdominal wall, while the true pelvis below the pelvic brim is surrounded the whole completely by bone. راح تلقي the concavity of the sacrum posteriorly. We will find the pelvic surface of the ilium and the ischium inferiorly and posteriorly, and we will find the posterior surface of the pubic bone anteriorly. So this is called the true pelvis. يعني the false pelvis راح نلقي البونز posterior and lateral. خلص الإلياك fossa راح يجيني الانتيريور abdominal wall, while the true cavity inside is surrounded completely by bone. لذلك it is called the true pelvis. It is also نفس هذا the true pelvis هو نفس the pelvic cavity. نفسه هو the true pelvic cavity. اوكي طبعا the contents فمن تجي يقول لك شنو الفرق ما بين ال false pelvis and the true pelvis. anatomically نقدر نقول اللي above the pelvic brim هو false, اللي below the pelvic brim هو true. anatomically نقدر نقول اللي above the pelvic brim محتواه راح يكون part of the intestine و anterior abdominal wall راح يكون anteriorly present, بينما in the true cavity محتوياته راح تكون the pelvic organs مثلا uterus in the female, rectum in both gender. اوكي تمام. فنقدر نفرق بهيجي حالة anatomically between the true and the false pelvis. This is very important. Also طبعا the pelvic brim هذه الحلقة الخضراء يعتمدون عليها أيضا جماعة النسائية to give the degree of labor. يعني usually the head of the baby is present above the pelvic brim. معناها the mother is never in labor, ما يكون عندها labor. لكن when the head of the baby starts to be conjugated with the pelvic brim and even descend down to the pelvic cavity, نقول للفيميل إنه بدأت تتحضر إنه تكون in labor stages. So it is also important in obstetrics and gynecology. This slide هذا السلايد هسه اللي راح نشوفه this is very important also clinically لأنه you can view from it from من هذا الكلام اللي هسه قلته إنه the pelvic brim also could be called نسميه the pelvic inlet, and the true pelvic cavity, the true pelvis, is also called the pelvic cavity. And the outer boundary is called the pelvic outlet. The pelvic outlet, okay? فصار عندي pelvic inlet, pelvic cavity, and a pelvic outlet. Okay, now we come to the pelvis with its dimensions. The importance about dimensions for a pelvis, we pay attention to the female more for the male. In the male ما عندي مشكلة بالdimensions of the pelvis whether contracted or wide أو كذا, ما عندنا مشكلة بي. لكن الفيميل يهمني إنه she has a wide pelvis because to accommodate pregnancy and labor for the sake of her baby and for her sake also to deliver normally and continue life. فالdimensions of the pelvis نعير لها أهمية to the female gender. How can we say that this pelvis is يعني مناسب and has the good dimensions to accommodate the uterus and the baby and to accommodate delivery. شو كد نقدر نقول هذا البلفس هو عريض ومناسب لأنه يكون normal delivery. أكو مقاييس مثلا يقول between the two anterior superior iliac spine. هسه احنا مندلينا وين الانتيريور superior iliac spine. يقول the dimension between the two spines بالعرض, طبعا انت تاخذ القياس بالعرض, it is from 22 to 25 centimeter. مثلا يقول لك القياس between the two ischial spines لازم يكون 9 centimeter and above. هذه شلون تقيسها by x-ray. we take an x-ray. طبعا بالبداية اكو فد معلومة يعني انه احنا مو اي فيميل تجي نقول لها، وخصوصا هي من تكون بكر يعني اول طفل إلها، مو اي وحدة تجي نقول لها ها خلي نشوف انتي الحوض مالتك ملائم او لا. نو يعني احنا اكو ناس خاصة ندزها حتى نعرف انه هل البلفس مالتهم is wide or not. منو من هذني الفيميلز تدزهم؟ يعني أنا من تجيني فيميل وأباوع عليها طويلة وعريضة، ومثلا حتى إحنا أكو فد سؤال نسأل بيه الفيميل، يمكن قسم يتفاجئون من هذا السؤال، بس مثلا أقول هل عفو أنت إيش قد قياس حذاء تلبسين؟ فمن تقول لي قياس الحذاء مالتها 36 وفوق 37 وفوق، يعني قالت 38 39 40، هذه she has a wide pelvis ما يحتاج انه افكر بيها. لكن من تقول لي 37 36 35 28، من تعطيني هاي الارقام اللي هي كلش صغيره، هاي اخاف من عندها، يعني اقول she might have a contracted pelvis. احنا اكبر جزء موجود بالطفل هو الراس، الهيد. فالهيد in order to pass through the pelvic cavity اللي هو يكون narrow cavity، in order to pass it should be wide enough. فاللي قياس يعني هيجي أحس بيها، يعني قلنا هي قياس حذائها 36 أو 37 وأباوع عليها ناعمة وصغيرة، I send her for an X-ray in a different view، AP view and lateral view، وأسوي dimensions. أول ما باوع to the ischial spine وأحط مثل ما قلت الإيدي لازم تكون 5 أصابع، فإن تكون الإسكيال spine on each side of the 5 finger breadth. بهيجي حالة من أشوف هيجي أقول she has a wide pelvis, it's okay. But if it is less, the dimension is less than 9 centimeter والdimensions أشوفها contracted, we ask the patient, we tell her you can never deliver normally and you should be planned for an elective cesarean section. لازم كل الحمل سواء هذا أو اللي جايات كلها تكون بقيصرية. Okay, this is the importance اللي تريد نقوله regarding the dimensions of the pelvis. أكو فد شيء اسمه the pelvic axis. It is an imaginary line and it is J-shape، مثل ما تشوفه J-shape. It represents the pathway of the head of the baby when it passes، يعني passes through the pelvic cavity. Importantly to know about the pelvis, I forgot to tell you that there is an anatomical position about the pelvis. أكو فد anatomical position about the pelvic girdle. إحنا pelvis it is tilted to an angle in which the anterior superior iliac spine and the pubic tubercle, the anterior superior iliac spine and the pubic tubercle is in the same coronal frontal plane. يعني البلفس صاير بأنجل، يتقدم لي قدام يصير بأنجل بحيث يصير الانتيريور superior iliac spine والpubic tubercle both of them in the same frontal coronal plane. بهيجي حالة راح هذا يعتبر الاناتوميكال position of the pelvis. Okay. Now to compare between the male and female pelvis, and we assume that the male and female are near in age with the same physical stature. يعني هنا أني المقارنة راح تكون بين الميل والفيميل، مو أجيب ميل طويل وعريض وأجيب فيميل قصيرة، مو قصدي الفرق بين هذولا، وإنما يكونون نفس العمر وتقريبا نفس الفيزيكال stature. And there are comparison between male and female regarding the pelvis. If we come to the points of comparison, for example احنا متعلمين وهذه فد قاعدة فد rule انه اي شيء bone تابع للميل يكون heavier, thicker with heavy and strong bony landmarks، خشن تكون دائما البون مالته ويكون دائما ثقيل. فهذا point number 1. بينما in female دائما يكون أخف lighter in the weight and with smooth يكون bony landmarks. The other point of comparison I have the false pelvis اللي هو ترى نفسه اسمه the greater pelvis اللي قلنا above the pelvic brim يكون in female shallow بينما in male يكون deep. الأسيتابيولم بالفيميل يكون small and faces anteriorly بينما in male يكون large and faces laterally. وهذه هي اللي تفرق لي ما بين المشية ترى بين الفيميل والميل. كلنا شايفين الفيميل من تمشي دائما foot in front of a foot شلون المشي مال الموديلز يكون نزاكة بينما الميل لأنه widely setted acetabulum فالمشية مالته تكون widely spread. Okay, فدائما الفيميل will walk in a beautiful way because the acetabulum is faced anteriorly, more anteriorly, while in the male it faces laterally. Also another point of comparison is the pelvic brim اللي هو نفسه the pelvic inlet. In female it will be oval in shape while in male it will be smaller and heart shape. ليش heart shape يكون؟ لأنه the promontory of sacrum in the male will be more tilted forward يكون أكثر طالع لي قدام فلذلك ينطيني كأنما indentation فيكون لي heart shape بينما in female no يكون oval. The pelvic brim يكون oval. The pelvic outlet in the female is wider while in the male is narrower. Okay, the obturator foramen in the female is oval while in the male it is round. The pubic arch هاي قلناها اللي هي pubic angle is greater than 90 degree in the female while it is less than 90 degree in the male. Also I have the iliac crests. شوف بالفيميل pelvis يكون less curved in the male تكون more curved. الإليوم أصلا in the female يكون less vertical لأنه widely spread بينما in the male يكون more ventricle. الساكرم bone الساكرم إذا نجي عليه هنا بالنسبة إلى الفيميل you will find the sacrum bone in the male it will be narrower and narrower set بينما in the female يكون wider in the female. The concavity همينة concavity of the sacrum also differs from male to female. Coccyx in the female is more movable, in the male it is less movable. Okay, ischial tuberosity in the male يكون larger while in the female يكون shorter. هذه صورة كلش يعني تجيب البلفيك inlet والoutlet والcavity والpubic arch يجي in a diagrammatically way to differentiate between the male and female. إلى البلفيك فلور تقرون pelvic floor وتكملتها ما تقروها ما يحتاج for your grade. Thank you very much.